Every September, there's a National Suicide Prevention Week. That's mainly because of the heightened risk for teens going back to school. To talk about the problem and ways to help through treatment and prevention is our guest from Franciscan Children's in Brighton, the medical director of the McLean-Franciscan community-based acute treatment program, Dr. Anthony Sossong. Thank you very much for being with us, Sam.
Thank you for having me.
First of all, talk about the difference between something as alarming as a risk for suicide and teens just going through a phase or being moody.
It's a great question. The teens are a turbulent time, certainly emotionally turbulent, socially turbulent. There are lots of things in school and work that can start to become responsibilities at that time. And the ups and downs can be quite profound. Those actually are risk factors for suicide as well. We think of suicide as being something that happens when there's a confluence of factors, an underlying psychiatric illness. In 90% of people who commit suicide, there is a underlying psychiatric illness. External factors can certainly play in, and so all of those things can be relevant.
What is it about September going back to school that makes this potentially worse?
So I just want to highlight between the ages of 10 and 24, the second leading cause of death is suicide. And so that's a big age group to be talking about. And the stress factors on one age group is not necessarily going to be the primary stressors on another. From ages 10 to 14, family stress tends to be sort of the most prominent factors. Socially, a breakup could be a much bigger factor later in the teens. Going back to school really incorporates a lot of stresses, not just stress on the individual socially and academically, but the family has to adjust as well. So there's a lot of turbulence at that time of year.
No, another part of the mix that we sometimes hear about from parts of the city are you've got children who grow up with violence around them. Yeah. It could be shooting too. Yeah. I guess that's one more thing that could make it a lot worse too.
Absolutely. Any kind of external trauma or things that would cause stress or worsen an already existing depression could certainly contribute.
What about some of the barriers to getting something treated? Because, I mean, if you're talking about suicide as often being a symptom of an underlying mental illness, you've got, I guess, multiple barriers probably, don't you?
Yeah, it's hard to talk about. The death of a child by suicide is an absolute tragedy, and it's hard to talk about, and it reinforces the stigma because well-meaning people don't know what to say, don't know what to ask. And I think it does get in the way. Well-meaning people avoid asking questions that they're afraid might hurt someone's feelings. There is a sense that people have that talking to a child about suicide or a teen about suicide might somehow make it happen. And the studies are very clear that that's not the case. In fact, as difficult as it is to have those conversations, those are quite protective. To have those conversations with kids.
It's hard enough to talk about someone having depression, isn't it?
Absolutely, it is, and the range of the human experience, and when it starts to take on a life of its own, becoming a psychiatric disorder, that's a very difficult and fuzzy place to be having those conversations. So on the one hand, the ups and downs of the teen years, as you talk about. On the other hand, withdrawing from school, social engagement, using drugs or alcohol, driving 80 miles an hour down the road, all of these things really just takes it beyond the sort of ups and downs of teens.
Plus, you could have a mental health issue overlapping with a more physical issue. Let's say you've got someone who's struggling with obesity, and then you got to coordinate the care. Yeah, that's a tangle, isn't that?
It is. It's a really good point. It's actually something that Franciscan Children's is particularly well suited for because it's a post-acute rehabilitation hospital as well as a leader in psychiatric illness. Those certainly impact each other, those disorders, and for those who have both of those conditions or more than two of those conditions, it could be quite devastating.
This is BNN News, and we're talking with Dr. Anthony Sossong from Franciscan Children's in Brighton. Doctor, how do you coordinate that? Because you call this a community-based treatment program. So what does that mean exactly?
Well, it's on the spectrum of care. So Franciscan Children's is committed to the mental health of children of all ages and at all places within the health treatment continuum. So acute psychiatric illness can be treated at an inpatient level. Then there are more community-based treatments and outpatient treatments, and Franciscan Children's is committed to the entire spectrum of treatment.
Well, probably the most important people as far as preventing at least the worst outcome is really people in the family. What can they do?
So it's a good question. It's a tough question, and it's the one that comes up over and over. Should I talk about this? Is it going to make things worse? It's not going to make things worse. It's what we know from research is that talking to children and teens, especially family members, about suicide, about their thoughts about death, about their feelings, is the best way to help protect against suicide.
Of course, when you have a conversation like that, you don't want to corner someone. So what's the best way to avoid that? So actually, I'm glad you mentioned that, because on the franciscanchildrens.org website, there is a list of sort of healthy habits that you can have in communicating with children. The overlying principle is really open communication. Don't assume that your own experience is the same as the child's. You can definitely use that to help guide your questions, guide your curiosity about the child's experience, but don't assume that your own experience is the same. And don't wait until there is a crisis or something urgent to talk about. Set up those times in advance. Really plan them out. Have conversations intentionally. One other piece of advice is about having an agreed upon code word. What does that mean?
Well, sometimes when kids are out in public or with their friends, there is a certain degree of difficulty having intimate conversations with parents around friends, and having a code word in advance can just kind of signal that there may be time to have those conversations without bringing that into the dialogue with friends.
Of course, what about the prospects of getting people through this? I mean, we've heard these cliches about, people can eventually work out of it. What have you seen over the years?
So I think that's one of the unfortunate things that comes out of the media and narrative about suicide, is that it's this inevitability. I think 90% of people who commit suicide have an underlying psychiatric disorder, mostly depression, mostly depression and anxiety, and those are incredibly treatable. So the warning signs can happen well before a kid is starting to talk about death, starting to talk about feeling guilty, or a sense of overwhelming distress. It can happen when there are signs of anxiety that gets in the way of school, home, tummy aches for younger kids, headaches, the kinds of things that just show that there's building distress.
We should mention that if people would like some more information about the prevention, warning signs, or even treatment options, you've got some information online there?
Yeah, at franciscanchildrens.org, we have a resource page, and we link out to a number of great resources from there. But I should say, too, if anyone is concerned acutely about a child's safety, that they shouldn't be left alone. They should be someone should sit with them and call 911, call the emergency department, do whatever it takes to keep somebody safe.
Thank you very much for being with us.
Okay.
Dr.
All right,
Anthony Sossong from Franciscan Children's Brighton.